This course has been designed for physicians who are or want to become medical supervisors in the California Medical Supervision Program. Other healthcare providers, such as nurse practitioners and physician assistants, who participate in the program will also find this course useful. The California Medical Supervision Program is designed to protect certain pesticide handlers who work with the most toxic cholinesterase inhibiting pesticides, which are toxicity category 1 and 2 organophosphates and carbamates. Exposure to these pesticides can result in the cumulative inhibition of cholinesterase activity. Cholinesterase is an enzyme essential to the proper functioning of the nervous system. As a medical supervisor, you play an important role in preventing adverse health outcomes by monitoring handlers' blood cholinesterase activity levels. In order for medical supervision to be required for an employee, 3 criteria must be met. First, the employee must mix, load, apply, or assist with the application of organophosphates and/or carbamates used in the production of an agricultural plant commodity. Second, the pesticide label must have the signal words danger or warning to indicate toxicity category 1 or 2. And finally, the employee must regularly handle pesticides for more than 6 days in a 30-day period. Using these criteria, it is the employer who must determine if their employees need supervision and send them for testing when needed. A medical supervisor is a physician who signed a contract with an employer to provide medical supervision to the employer's employees in the California Medical Supervision Program. The next set of slides will outline the 7 main responsibilities of medical supervisors. Medical supervisors must possess a copy of and be aware of the content of the following guidelines for physicians. The guidelines are produced by OEHHA and can be found by calling the listed phone number or emailing OEHHA at the address provided. You can also download a PDF version on the following OEHHA webpage. The purpose of the guidelines is to instruct and advise physicians. They are not intended to constrain the exercise of sound medical judgment. Regulations cited set forth minimum requirements and do not restrict physicians from providing more intensive medical supervision. Employers are required to have a contract with a physician to provide medical supervision for employees in the program. Physicians in the program are required by law to register with OEHHA. Registration is free and takes about 3 to 5 minutes. It must be renewed annually between January and March. The registration form can be downloaded from the California Medical Supervision Program page by accessing the following link. There are currently over 100 medical supervisors in California that are registered with OEHHA. Physicians' name and contact information are posted on OEHHA's website and are available to employers to help them locate local physicians who are qualified to be medical supervisors. After reviewing the guidelines, establishing a contract with the employer, and registering with OEHHA, medical supervisors can begin monitoring cholinesterase activity levels. Both plasma and red blood cell, or RBC, cholinesterase activity levels are required to be assayed throughout the program. The blood test order must state the worker's participation in the medical supervision program, the purpose of the test, and the name of the medical supervisor. All blood samples must be sent to one of the state-certified labs. A list of state-certified labs can be found on the following California Department of Public Health webpage. The blood test order must indicate the purpose of the test. Use one of the following terms to convey this information. Baseline tests are done on workers before exposure occurs in order to establish the levels to which follow-up tests are compared. Follow-up tests are done on workers who have handled cholinesterase inhibiting pesticides for more than 6 days in a 30-day qualifying period. And finally, recovery tests are done after a worker has been removed from working with these pesticides because their cholinesterase activity levels have dropped below one of the removal level thresholds. Baselines should be established prior to the employee's handling of cholinesterase inhibiting pesticides. Both plasma and RBC cholinesterase activity levels should be measured. Due to inter-individual variability, laboratory normal values for the baseline should not be used. Baseline levels should be verified every 2 years. To determine each individual's baseline, OEHHA recommends using the average of 2 exposure-free tests taken 3 to 14 days apart when the worker has not been exposed to any cholinesterase inhibitors for at least 30 days. Consult the guidelines for further instructions on establishing baselines. The medical supervisor should interpret the test results after they are processed by a state-certified lab. These results should not be interpreted by the lab, the employer, or another healthcare provider. Medical supervisors can use the online calculator and flowchart on the following OEHHA webpage to help them interpret results. Physicians must send results and any recommendations to both employees and employers within 14 days of receiving the test results. The employer must follow the recommendations of the medical supervisor concerning matters of occupational health. The next slide has recommendations that medical supervisors must make based on the test results. Medical supervisors must make the following recommendations to employers based on the employee's test results. If plasma or RBC cholinesterase activity levels are less than 80% of the baseline, then employers must conduct a review of the workplace environment, safety equipment used and its condition, and employee work practices. If RBC cholinesterase activity levels are less than or equal to 70% of the baseline, or if plasma cholinesterase activity levels are less than or equal to 60% of the baseline, then workers can continue working, but they must stop handling cholinesterase inhibiting pesticides. Employees can return to working with cholinesterase inhibiting pesticides only after recovery to 80% or more of baseline for both plasma and RBC cholinesterase levels. Regardless of cholinesterase activity test results, workers should be evaluated by a physician if pesticide exposure causes illness. If the physician diagnoses pesticide illness, then the worker should be removed from the exposure. Finally, in California, all physicians are required by law to report any known or suspected pesticide illness or injury to the local health officer within 24 hours. Medical supervisors must also report as a pesticide illness any worker in the program with cholinesterase depression indicating pesticide exposure. More information on reporting pesticide illness can be found on the following OEHHA webpage. In summary, medical supervisors must be a physician. They must possess a copy of the Guidelines for Physicians and be aware of its contents. They must have a contract with an employer in order to supervise their employees. And they must register with OEHHA. Both plasma and RBC cholinesterase tests must be ordered for employees. The purpose of the test must be indicated on the order as either baseline, follow-up, or recovery. and test results must be compared to individual baseline values. Medical supervisors must recommend the employer to take action as needed. Test results and recommendations must be sent to both employers and employees within 14 days of receiving the results. And any known or suspected pesticide illness cases must be reported to the local health officer within 24 hours. And remember, if needed, medical supervisors can provide more intensive supervision than the minimum requirements set forth in the guidelines. This concludes the training. If you would like more details or if you have any questions, please contact OEHHA using the following information.